Newton is standing by at the Bongani Regional Hospital. Richard?
Hi Leanne, how are you? Welcome back to Bongani Regional Hospital. As we said earlier, this is the final stop of a media tour by the Free State Health Department, led by its MEC, Dr. Benny Malakoane, to have a look at the province, have a look what's being done. It's part of back to care. It's part of looking at what has been achieved and what still needs to be achieved. And joining me now in the corridors of Bongani Hospital is the MEC himself. MEC, thank you so much for joining us. Your media tour, you've had a week where you've been travelling all over the province. We have seen in the past there's been issues of stockouts, there's been issues of doctors that have left and been shortages. What's the final word on what you've seen this week?
Let me take this opportunity to thank you, Mr. Newton, for having me, and also for me to give a perspective of what this media tour that we had embarked upon this week was about. I wouldn't say the final word because it's only beginning. What we did, we had identified 11 towns for the first leg of our media tour, wherein we were going to inspect our facilities, do a walkabout, and to ensure that we interact with patients, to establish directly from the patients and staff, to establish directly from them about the nature of our services, how happy they are or how unhappy they are about the services, where improvements need to be done or where we need to strengthen the good things that we would be doing. And again, for me to check whether all the deficiencies that had been identified previously when I had done my solitary visits have been attended to, and if not, what the problems are and what remedial measures are going to be put in place to ensure that those issues are addressed. So this is what we did in the beginning of the week from Monday, where we visited a town of Heilbron, and we visited our hospital. Tukullo Hospital is one of our district hospitals. That hospital is very impressive in terms of its compliance with the 6 national core standards, particularly the fact that it's one of those hospitals that had represented the province on a national scale with regard to assessments regarding cleanliness amongst others. And the last time I had checked their score, they had attained 100% for that. Beautiful, well organized. The administration there is a model type of administration that one would like to see if maybe one had one's wishes to see it replicated in all the other facilities in the province. Then from there, we went on to a town of Kopis, where our Operation Back to Care, Hlasela Health Hlasela wing, because remember we have this flagship program in the province that we call Rea Hlasela, and on the health side of things we do our part by doing Operation Back to Care. There, together with our partners and our community health workers led by our program managers, we do door-to-door campaigns wherein we visit each and every household, profile each and every member of the family, not only on their state of health, but whether they have IDs or if there are children, they are receiving grants. If not, then we profile all those, after which then we embark on formal reports, including correspondence to the respective departments for them to complete the loop that we would have opened by identifying some of those deficiencies on their areas of responsibility, for them to close them and to complete the process.
And so you were saying that you'd like all the hospitals to look like that. What's stopping it? Is it budget? Is it skills? Is it what's stopping us doing that?
Look, it's a cocktail of factors, because you would know there's no one manager who's the same as the other. Their level of their characters and attributes are different. That is why you will find that there are people who would be called good managers and others would be called mediocre or average. Others would definitely be bad managers who under normal circumstances should be flushed out of the system. For that to happen, the team there that is running that hospital, it works like a well-oiled machine. there is good leadership, which one would love to have at all times across all the facilities. They are attuned to the needs of the communities that they serve, and they work as a team. So that's what one would always love to have in any one facility. And like I said, if it can get replicated across all the other facilities, that would be lovely. But we do our best under my leadership in the Department of Health to ensure that that happens across, because I have a responsibility to ensure that I establish the psychological climate in the department as a whole, including the individual facilities. That's why I cannot abdicate that responsibility for establishing and maintaining the correct psychological climate to anyone. I can only encourage leaders of the various facilities to do like I do, to ensure that they continue to influence those that they lead positively, to continuously encourage them to do good, and prevent at all costs exasperation or despondency, so that they don't get deflated, but they continue to derive motivation from those that have made the working environment conducive for them to unleash their talents.
Thank you very much, sir. Thank you. That was the MEC for Health, Dr. Benny Malakoane, giving us a brief on what they've seen, what needs to be done, what is being done, and what is going to be done even better. So from the Bongani Regional Hospital in Welkom, back to the studio after this break.